Sitting here with Dr. Brian Harris, and first of all, thanks for letting us see the place again. I'm used to seeing it. I normally do not come dressed up, so it's nice to sit across from you and talk about just your practice. You could have gone anywhere. I mean, I know you studied dentistry. You could have worked for anybody. What is it about working for your dad and the family practice that means so much to you?
You know, it was the environment of coming out and having an instant mentor, somebody that I knew I could trust. And growing up around this office, I felt like I already knew a lot of the patients, and it just seemed like a better fit for me than to try to go out and recreating something on my own.
Is there more pressure when you work for your dad?
Absolutely. It made me get my skills and my speed up and my communication up as quickly as possible so that I could treat people the same way that he always had.
You know, you're obviously younger than your father, so to see all of these advances, the new technology coming out as it relates to cosmetic dentistry, that's got to be exciting for you.
It is, and that's the big thing right now is technology and having a grasp on that, and we try to always kind of stay on the cutting edge with that stuff, and it's been fantastic.
How many patients come in a little bit nervous? You know, I was very lazy in getting to the dentist. I can't tell you how many different dental cleaning appointments I missed until I came to you guys. I don't think I missed one, but I was nervous. Is that common?
Very common, and I think now so more than ever. But the great thing is now there's so many different ways to deal with it, from full sedation to taking a pill before you come in to even just being distracted with TV or nitrous. But there's many patients we see are nervous.
Am I the only one that's actually, I have actually fallen asleep on that chair.
It's pretty common nowadays. We try to make that happen at every appointment if we can.
Is there any issue you guys can't deal with? I came in with a fake tooth. I had a crown. There was always some darkness up here. A lot of people might not have noticed, but I noticed, and it drove me nuts. Is there anything that you can't fix, can't deal with?
No, luckily we have the experience where we've seen a lot, and so we can usually fix most things. Now, if there is something that's outside our comfort zone or something that we know is better done by a specialist, we've got a great team of specialists that we work with to help us with those patients.
You know, it's really cool when I get on your website, and I've dealt with all of the staff, not just the doctors, but especially for my cleaning appointments or the regular things. You've got a whole section on your website for the hygiene staff, and all of the gals are profiled. I would think it's kind of empowering for them. They're not just on the staff here, they're really part of the family.
Yeah. We've looked long and hard for good people, and our staff knows that they are important to us, and we've tried to find the best of the best out there, and so we want our patients to know about that. We want them to see who they are, the training they have, how great they are with patients.
Can you do me a favor? Would you please pull Annie aside in particular? That woman has dealt with my bad breath every time I get. Would you just please apologize?
I will let her know on Monday.
Yeah. Hey, by the way, thanks for my veneers.
You're welcome.
Thanks for my teeth.
You're welcome.
Dr. Brian Harris, I encourage you to give these guys a call, free dental consult. Meet Dr. Brian, Dr. Joe, Dr. Scott. Meet all the hygiene folks in person.